Hi, my name is Armin. If you're watching this video, you've probably recently experienced a motor vehicle accident. We can all appreciate that this can be a very challenging time. We thank you so much for choosing us in being able to aid you in your recovery. I'd like to take this time in this video to explain to you the different professions that we have, how they all work together in order to provide the best form of care for you. On our team, we're comprised of physiotherapists, clinical counselors, occupational therapists, and kinesiologists, also known as active rehab. It is very important to know that with your motor vehicle accident, you are already pre-approved for physiotherapy, clinical counseling, and kinesiology services, meaning that you can tackle these services right away and get the treatment that you need. You do not need a doctor's note for those to initiate those treatments. However, if occupational therapy is something that you need or you require, something that's going to help facilitate your treatment, that's where we need a doctor's note in order to help get that going for you. The team will always guide you with that and recommend that if needed. Also, your doctor might recommend that as well. So again, thank you so much for choosing us. I hope you find this video helpful in navigating your way through your recovery, and please let us know if you ever have any questions. As a physiotherapist, we are primarily involved in assisting you with your physical injuries. So that could be any sort of soft tissue injury you've suffered, maybe bone breaks, fractures, any sort of nervous system kind of injuries or irritations. Those are primarily the things that we assist with. We will guide you through the best ways, evidence-based wise, to assist you in your recovery. What are some things that you can do at home and also in clinic that can help accelerate tissue healing and really getting you back to the way things were prior to the accident. When you do visit a physiotherapist, you should expect some form of manual therapy. So that could be some soft tissue work, some sort of massaging. You should expect some form of a modality, for example, a TENS machine, an ultrasound, or it could be some form of acupuncture or other forms of dry needling techniques. And you should expect exercise-based programs, some real home-based stuff, things that you can do on your own, and some of the things that are specifically targeted for those injured or irritated areas. But ultimately, your physiotherapist and you will work together to ensure that your physical health, your physical mobility can get back to the way it was prior to the injury, so that you can continue doing the things that you love and enjoy and making sure that life goes back to the way it was. The next thing I'd like to discuss is clinical counseling. When is clinical counseling referred after a motor vehicle accident? Anybody can be referred to a clinical counselor after a motor vehicle accident. ICBC is great in the sense that they do approve clinical counseling for their insured clients. This is obviously a massive thing, and ICBC does a great job in supporting this because it's such a big need. Anybody who is suffering from mental health kind of issues post a motor vehicle accident, somebody who's dealing maybe with anxiety, anybody who's dealing with challenges, maybe they just can't quite do things the way they used to because of feeling certain mental blocks or mental challenges throughout their day. Often what we tend to see is people become a little bit timid or a little afraid to drive their vehicle now, or to get in a car with somebody else even, because those flashbacks kind of come about. And this is where chatting with a clinical counselor, setting up a program, and really getting that extra assistance and care can really help and propel your rehab. I personally often find that when a clinical counselor is involved in someone's care, they tend to get better a little bit quicker than they would otherwise. What I see on a daily basis as a physiotherapist, my clients who have gotten to motor vehicle accidents, if we can address and assist kind of the mental blockages, some of the mental challenges that arise after a motor vehicle accident, along with the physical needs, which is something that we specialize in and help with, then the rehab just goes so much smoother and it becomes such a more comprehensive care. The next thing I'd like to answer is, when do we recommend an occupational therapist to get involved? When do we think that it's something that's in the best interest of our client to receive this form of treatment? Often, if somebody has been injured to the point where they are struggling or can't do a majority of activities of daily living at home, they're struggling with life skills such as organizing things, making their appointments on time, maybe they've experienced a form of a concussion. If they're also having challenges, let's say at work, they quite can't do the work as they once used to, they're limited in their functional capacity or capability in being able to complete their tasks at work, that is often when we do make those recommendations for an occupational therapist. They become kind of like your case manager, where they oversee a lot of things that you're doing that are outside of the clinic, and they really help you to regain those functions and be able to complete those tasks. In addition, if you need equipment to assist you to improve your function, to help make things easier, to aid in your recovery. So let's say you needed a wheelchair because you fractured your foot or you broke your foot and you can't quite walk right now because of the fractured leg. That is something where an occupational therapist can come in, provide that recommendation of a wheelchair, work alongside ICBC to help make sure you get all the supports that you need to get better. So when do we start active rehab? Active rehab is usually completed by a kinesiologist. This individual is usually somebody who has completed their Bachelor's of Science in Kinesiology, and they're very knowledgeable in providing safe and specific exercises tailored for your needs. Often, active rehab includes doing exercises, learning specific body movements, so maybe some specific stretching, some strengthening, things that are best suited for you. And you will be usually working with the kinesiologist on a one-on-one basis, and they will provide all the equipment that you would need to really help and show you a program, something that you can do, something that you can take away and be able to really do on your own. At the end of the day, movement, activity, exercise, all of those things are huge and key factors in aiding in your recovery. And if they can really help put a program together for you, and you combine that with your other treatments, such as your physiotherapy, your chiropractic, or whatever it might be, that's when you get amazing results. It is important to know that you actually can start active rehab right away. You want to take your time with it, but active rehab does not necessarily mean we're going to get you in the gym, get you up and running and doing push-ups and all those things. Active rehab can also be simple things, but important things, such as learning proper positions of stretching, learning how long you should do an activity for, and just really getting the basics down. It is a huge part of your recovery, and it works very well when done with physiotherapy. Sometimes, however, if a person is really suffering through a more serious injury and they just can't even do any sort of movement, or maybe they just don't feel quite comfortable or confident with it, sometimes we will then recommend active rehab to be completed a little bit further down the line along your rehab. So maybe when you're feeling about 60 to 70% better, but it really is a fluid and dynamic thing. And that's something that you can always work with your therapist, your physician, and especially your kinesiologist, the person who of course will be working with you one-on-one to help make sure they help you out as best as you can. So there you have it. Hopefully by now you have a little bit more information as to what your physiotherapist does, what your occupational therapist does, what a clinical counselor can do for you, and how active rehab works. Hopefully you can appreciate that having these professionals working together in a collaborative manner, focusing primarily only on your care, can significantly help and aid your recovery and speed things up as best as possible. And we pride ourselves with being able to communicate with your doctor to make sure that you're receiving the best form of care for your needs. Thank you again so much for choosing us, and we certainly all look forward to working with you. And if any time you have any sort of questions, concerns, or whatever it might be, let us know. At the end of the day, we want to be here for you. That's why we're here, and we want to make sure that you always find your treatment worthwhile and you always feel that you're progressing.